My name is Larbi-Odam. The topic for my information speech is health disparities in America. From culture to disability to sexual orientation, health disparity is prevalent and prominent in our societies today. In the year 2000, the CEO of the company that I work for collapsed. I had to call the ambulance to take him to the ER. Everything was fine with respect to the care that was being given him until his gay partner showed up. Attitudes began to change. Some of the staff would not even touch him, all because of who he was. I didn't know that people with different sexual orientation experience low quality of health because of who they are. Today, I will discuss disparities experienced by people with different cultures. Secondly, I will discuss the disparities experienced by people with disabilities. And finally, I will discuss the disparities experienced by people with a different sexual orientation. Cultural barriers in the quality of healthcare. Effective communication is critical to the quality of care received. Healthcare is information management. Patients with limited English proficiency are treated by physicians and healthcare professionals who are proficient with only English. Both staff and clinicians underestimate the language barrier and eventually causes misinformation and thus low quality of health given and received. So both staff and patients may think they are sufficiently proficient in a language, but they are not. Provider preference affects the delivery of care. Female Somalis, for instance, will not allow male physicians to examine them. Physicians cannot provide quality health care needed in this situation. Some Asian cultures do not allow minors, even teenagers, to answer questions when accompanied by an adult. Information being given to the provider by the adult could be false. Now that we know about cultural barriers, let's come home and talk about everyday people who may live next door to us or a block away from us. Disparities experienced by people with disabilities. 1 in 6 adults in the U.S. live with a disability. The U.S. Census 2000 reported a 49.7 million disabled people living in America. Individuals with disabilities report poor health. People with disabilities are not encouraged to go for regular doctor visits because of long waits at the doctor's office, and they are often ignored and overlooked. They do not maintain routine checkups like dental, pap smears, mammograms because of lack of appropriate transportation. Now that we know about disparities experienced by people with with disabilities, there's another group of people or a group of individuals who have the same civil liberties that we enjoy but experience a low quality of health. Disparities experienced by people with different sexual orientation. Report and survey by the National Center for Transgender Equality and the National Gay Lesbian Task Force revealed that 19% of lesbian, gay, bisexual, and transgender are being refused care, and higher numbers among people of color. According to this survey, 28% of people with different sexual orientation postponed medical care due to discrimination, 48% due to health care due to inability to afford health care. Uninformed physicians. A lot of physicians are not well informed about how to take care of these people. HIV infection is high among this group of people. So due to these statistics, people with a different sexual orientation have a greater chance of low quality health care. Today, I have discussed disparities experienced by people with different cultures. Second, I discussed the disparities experienced by people with disabilities. And finally, I discussed disparities experienced by people with different sexual orientation. From culture to disability and to sexual orientation, health disparity is prominent and prevalent in our society today. When we mention health disparity, we mostly think about race, ethnicity, socioeconomic factors, but health disparity in America are experienced by a group of people who are mostly overlooked or ignored that is a lesbian, gay, and bisexual, and culturally different immigrants.